we're not quite live yet. Zoom is setting up the streaming service.
So we are streaming both on Facebook Live and YouTube.
And we are now live on Facebook.
Okay. Hello, everyone. I think we should be all the way live right now. So welcome to your COVID-19 communityresources.com town hall meeting powered by the Center for Closing the Health Gap. I'm Council Member Jan Michelle Lemon Kearney, and I'm moderating today. Joining me a little later is going to be Radio 1 superstar Tropicana. So you might remember, if you were with us back on January 9th, we had a roundtable discussion on race in America and the vaccine. And several of our panelists, including Miss Ebony J, who will be with us today, and DJ J Doe, who will join us later, they were a little reluctant to take the vaccine. They also were telling us about what their young viewers were saying. And so we're going to get an update today and see where we are. 3 months later, here we are again, and we're talking about race in America and the vaccine part 2. So we'll see today if our guests have changed their minds or their attitudes about the vaccine. Before we get started, let's get a shout out to our producers and tech team, John Reichel and Lauren Harden, because they make it happen. As a reminder to all of you, we are recording this session so that we can repost it on the COVID-19 communityresources.com website and other platforms. To all of our attendees, please start entering your questions and comments into the Q&A on Zoom or into the chat if you're on the Health Gap's Facebook Live page. Okay, so let me introduce you to our panelists. Returning from the January 9th town hall, we have Miss Ebony J from 100.3 FM Cincy R&B. Joining us a little later should be DJ J Doe from 101.1 FM The Wiz. So we'll see if anything's changed for them. We also have with us Dr. Lou Edgy of UC Health and the Cincinnati Medical Association. And she's become a national speaker about the COVID vaccine. So she's got lots of information. We also thought we'd get another perspective. We've got our Cincinnati Fire Department Assistant Chief Sherman Smith. So we're going to ask him some questions about the response here in Cincinnati. And we have Morgan Owens, an entrepreneur, author, national columnist, and social media influencer. And she's going to talk about her experiences actually with COVID, and we'll talk to her about the vaccine as well. So before we get started with our questions, let's just get a few intro remarks from our panelists. So may we start with Dr. Lou Edgy.
Hi there. Thank you so much for the opportunity to hopefully move the needle from vaccine hesitancy to vaccine hope. I am Lou Edgy. I'm a family physician. I'm here in Cincinnati. I take care of all age groups. And I'm the Associate Dean of Graduate Medical Education at the University of Cincinnati. So I train physicians, and I'm responsible for around 700 physicians in training of all specialties. Additionally, I am a Moderna trial participant, and we are at day number 193, I believe, today. Wow. But I did end up getting my Moderna trial shot number 1 in September and the second one in October. Did not find out that I'd gotten the shots until we had what we call an unblinding visit on Insurrection Day on the 6th of January. I found out whether I'd gotten placebo, which would have been saline salt water, or whether I'd actually gotten the vaccine. So just was really excited when the word came out from the FDA that our vaccine was approved. I had entered the study when we weren't really sure whether this was going to work or not. We had no vaccines at all. The other thing is, the thing that prompted me to get involved in the study in the first place is that I had the death of my stepmother, who was young and healthy, and over the course of 8 days succumbed. Subsequent to that, between the time I entered the trial and the time that Moderna got approved, we had 3 more deaths in the family, and none since then. So one of the biggest things that I've wanted to do is just to make sure that I can get the message out not to regret not getting your vaccine. If you're going to say no, we really need to make sure you have a really good reason. And my job is really to try and help bridge the gap, knowing the historic truths that have occurred with Black folks today and in the past, and the things that have been put into place in medicine to make sure that we don't go in the same direction in some of those areas. So thank you for having me.
Thank you so much, Dr. Edgy. You said a lot there, so many areas we're going to cover. So we'll have a chance to go back and talk about how you felt comfortable enough. I don't know if you felt completely comfortable, but comfortable enough to actually get into the study. And so that's going to be really important. So we'll go back and talk about that. But let's get some intro remarks from Assistant Fire Chief Sherman Smith.
This is fancy. First of all, I feel outclassed by all the fancy folks that are here. This is awesome. It's interesting that a little bit over a year ago, January of 2020, I became involved with the health department. My responsibility in the fire department is I am a planner for the city, and I'm responsible for emergency management to make sure that the resilience of our city and our preparedness on a number of other issues that I never imagined when I took this job I'd be dealing with, doctors and epidemiologists related to a vaccine and disease and things of that nature. So this is unusual, and I've learned a lot over the course of the last year or so. Early on, I became involved in planning an alternate care site, to treat overflow from the hospital. Who would have ever thought it, and to see how many pieces it was going to be required to make that happen for the city because we were in such dire straits. But now I'm involved primarily in assisting the health department in setting up vaccines or vaccine stations or clinics, if you will, to make sure that we make as much available vaccine to those who want to take it. But I think the thing that's most interesting about it is to see what this event over the last 14, 18 months, how has it affected our society? Who would think that we wouldn't be able to just go to a neighborhood restaurant and have a meal or go to concerts like we might have been able to do before, or that you would have to remember, go back to the car, get a mask to go into Home Depot. It just has changed our community significantly. And I think sometimes, and maybe later, we'll see the emotional impact to our community, what it has done to us, the people that we've lost and never got to say goodbye to. The impact is huge. And we're not out of the woods, right? So this is, I think, a healthy conversation. I'm excited about, just talking through some of what people are going through. I've received the Moderna vaccine in phase 1A, and even though having received that, we still don't see the norm that we all hope to see. So I think all the conversation that moves that toward, having some measure of whatever the new reality we're going to experience. I'm excited about being a part of that. So I appreciate you having me as a part of your panel today.
Thank you so much. And I have to say hats off to you to be, right there at the head of planning a response to something unlike anything we've seen in 100 years. So, it's just huge. And so thank you for that. And so the next person, let's get some comments from Miss Morgan Owens.
Hi, everyone. Thank you, Jan, for that great intro. I don't think I need to add anything else to that. Yes, I'm super excited to get on here and talk about my experience, especially for my generation who seems a little bit iffy to take it. I'm a little biased because I have one of the best health professionals that I know, my father. So, getting his advice, I trust someone who has 2 degrees from Yale Med School above, the internet fake news any day. And so, he's
got another degree from Harvard. So he's got a lot of degrees out there.
Yes. And, my English degree does not compete with his degree. So I'm going to take his advice over anything else. And so, having been the first in my immediate family to have COVID, I was very eager and ready to get the vaccine because it's unlike any sickness I have ever went through. And I know it's different for everyone, but, being single, living alone, it's not something that is fun to go through by yourself. And, how it's affected everything from not being able to hug my parents for over a year, not being able to really do what I used to do as a living, as an entrepreneur. So COVID has really flipped my world upside down. It's changed a lot, but it's also brought a lot of blessings in my life, but still nonetheless, it's so important for me, especially as an influencer, to raise my voice and, let people know that, my experience, would also let people know to know the facts. It's your personal decision whether or not you want the vaccine, but don't let it be because of some fake news that you've seen on the internet or, from your auntie, cousin and them that got some bad information as well. So at least know the facts and then make your own decisions. So I'm super excited to share my story and my perception, and happy to be here with everybody else.
That's great. And I was going to, I was thinking back to, when we first shut down, it was the very weekend that we had planned a Black Women's Health Fair. And we were all excited about having that at the Kennedy Heights Arts Center. And then suddenly it's like the world shut down and we were like, well, we've got to cancel it. So that was pretty horrible.
And we thought it'd be only until like August. I'm like, okay, let's move everything back to August. We'll be safe by then.
Right.
Here we are almost, over a year later.
That's right. Okay, Miss Ebony J.
Glad to be back.
We're glad to see you.
It's definitely been a year, like you said. We've had to adapt and readjust. So I'm glad to be back in the conversation. Definitely have new perspectives and new questions to ask. I still haven't taken the vaccine because of, again, the different things that I've heard, and I want to get clarity and more information on. However, like Morgan said, our lives have been turned upside down during this process. And because outside is beginning to open back up, my life as a radio personality, as a DJ and influencer is beginning to change, and I'm getting more gigs. So this is, again, making me try to make the right decision and want to make the right decision, not only for just me, but for those that are around me. So I'm glad to be back and here in this conversation again.
I know, we really appreciate your perspective. So, given that, now, so you're still skeptical. 3 months ago, we were trying to talk you into taking the vaccine. We didn't quite do that. So let's hear about, where you are now. What kinds of things are bothering you? What information you, and also, all of your viewers, all of your listeners, what are you hearing? What's bothering you? What's bothering them? Tell us about it.
Well, I was ready to make the jump simply because my mom had scheduled an appointment for me. And I was like, hold on, what is going on? Well, she's like, well, I'm going to get mine. Your sister's getting hers. We want her to be able to go back to her day program because my sister has developmental disabilities. All of those resources have shut down. And my mom has now had to work from home with her. And so she's not able to go back to work. But because they have the vaccine, that's now their only way of being able to have a normal life again. So my mom's like, we're getting it. You're getting it too. And I'm like, hold on now, wait a minute. I still have questions. I haven't decided. I don't want you to make this decision for me. And when I spoke to Tropicana and she said that we were having another conversation, I said, this is the perfect time to come on and get the rest of those questions that I have, because I don't want to make the wrong decision. While I was ready to jump and make the decision, the Johnson & Johnson pullback happened. And I'm like, oh my goodness, see, this is a prime example why I don't want to get it, because somebody out of those numbers, those 6 people out of the 7 million who have received it are receiving different situations. And that's my biggest fear, is that, yes, I am never the one in the norm. I can never do what anyone else do. I always get a different reaction. And so that's why I'm terrified. So today, that was one of my questions was, what can you say to those people who are skeptical now? Because we have been pulled, the Johnson & Johnson has been pulled and no longer is being given, which was so funny. That's what my mom actually had me scheduled to take.
I was just going to ask you. Yeah, I was just going to ask you which one. So a couple of different things. One, the Moderna and Pfizer vaccines are a completely different mechanism of action. So nothing changes what happens with those two. So they are still 94% effective and they're completely safe. So those are still options for you available, and we can have that portion of the discussion down the line. As far as Johnson & Johnson, you were right. There's 1 in a million folks, women between the ages of 18 and 48, who did get clots within 2 weeks of having J&J. Now, we have not been able to find any connection. Just because they, the cock crows at sunrise doesn't mean the cock crowing made the sun rise. And we've not been able to find an association. And the important thing that we have to state about this is, number one, that the incidence of getting the clots that have been found in J&J, it's usually 4 to 5 people per million in the normal situation, not related to COVID at all. So the fact that we found 1 per million is actually less than what we'd find in people who haven't had the vaccine at all. So that's the first thing. The reason that there was a pause is because when you get a blood clot, usually what a doctor does is give you a blood thinner. They give you a blood thinner and that busts the clot and things are good. The thing about it is that in this situation, the clots happen and the platelets, which is something else that makes clots, was low. So the problem is that our normal treatment for this kind of clot is a little bit different than it normally would be. And that's why the pause was on. Having said that, J&J is looking actually to come back within the next week or so because we've disconnected the two. There's actually not a connection that we've been able to find. So that announcement is probably going to happen within the next 7 days or so. And it'll probably be back on the market, just to let you know.
And Dr. Edgy, so my understanding from the Johnson & Johnson issue, and for anyone who's listening and is saying, yeah, we heard something about it, not sure what happened, but 6 people ended up with blood clots. And did all 6 die or just? No,
not all 6. First of all, they were all women. Second, one of them passed away. And again, the question is, was this directly related to the clot? It was probably related to the clot, but again, we've not been able to connect the clots to J&J. Again, folks who normally haven't even had Johnson & Johnson, 5 out of a million get clots like this. We found 1 out of a million getting clots. So
and there was some condition they had, right? It's called low platelets and blood clots or something.
Right. That's what I was saying. That's why they paused, because again, the issue is that when you treat blood clots, you usually give a blood thinner called heparin. And so the pause was primarily to make sure that physicians don't automatically give heparin to the patients when they find a clot, that they ask and check for the platelets, because with the low platelets, giving heparin can actually make the situation worse. So the pause was primarily out of an abundance of safety and making sure that physicians were able to go ahead and get up to speed and know what to do and not put patients in further harm as they were treating patients who come up. So
and people initially really wanted the Johnson & Johnson.
Yes.
Because you only needed one
and
shot.
done.
Whereas with Pfizer, Moderna, you need to go back after 3 or 4 weeks and get a second shot. But how do you feel about that, Ebony J? Does that make sense?
Well, yes, that was the funny thing. That was the reason why we were getting the Johnson & Johnson. My mom didn't want my sister to go through that pain more than once. And then when they went to go get the Johnson & Johnson is when they were told to get the Pfizer because of what happened. So I definitely do understand that. But my question is this like a relationship? Like once I get it, am I going to have to come back and get it again for another time? Like, how long does this vaccine protect me?
Yeah, so that's actually a great question. I'm in the Moderna trial for the full 25 months because the original virus, which we call the wild type, we don't know how long it's going to, when we give the vaccine, how long that vaccine is going to last. Usually, however, if you do have your immune system respond to the vaccine and that immune system is really good and strong past 4 months, usually you will have that last all the way up through 1 to 2 years. The exception here is that now we've got these variants that have spun out. So the original Moderna vaccine was to take care of the original virus that we had out there. Now that we've got all these variants, the B117 variant, which is the predominant variant here in the United States, Moderna does cover that right now. But the other variants that are coming out and becoming more prominent, we're most likely going to have a Moderna booster by fall to cover the variants because they've changed. It's almost like the key and the lock don't fit anymore. If you have a variant, if you get a variant, the key still fits for the original virus. But the original virus is being overrun as these cases get more and more. So this is why it's really important. The variants actually grow in areas where people are not vaccinated and they're not taking precaution. So the more people we get vaccinated, the lower the variant population of virus will be. So they're going up. All the cases are going up just about everywhere we are. In Michigan in particular, that line, we had our little bump in April, we had another bump in June, another bump around Christmas that was much bigger. We're coming back up. In fact, Michigan is on this sort of direct trajectory straight up because they have got hardly anyone getting vaccinated. Okay, so they're much lower on the vaccine totem pole, but then also they have high variants. So that combination is not a good combination.
And Franklin County, which is Columbus, has gone purple too, which is the worst. So that's a little scary, but we'll get back to talking about that. I just want to say Tropicana has joined us. Hey, Tropicana.
Good afternoon.
How are you? Welcome.
Good to be chatting with you guys today. I wanted to ask Mr. Smith a question. Mr. Smith, most firefighters have at least had the opportunity to get the vaccine. Are some refusing? And if so, how are those vaccinated reacting to those who are refusing?
So we had two situations that exist in the fire department. We were in 1A, so we're early on, less information. And so we're a microcosm of what is in our society. Half of the fire department is below about the mid 40s in age. So they mirror society. They have some of the same questions. We're not immune to being uncertain. The thing that's different for the fire department is that the majority of them, biggest part of the fire department, about 650 of the members, were on the street treating sick people, right? So they have a good idea about what this virus could do to people. And so many of them were infected. We had about 200 of our 850 members that actually got COVID. So because they had active virus, they had to wait. Many of them had to wait beyond their 60-day period of time, beyond the virus. And because of their experience with the virus, many of them were on board. They wanted to make sure that they didn't have a revisit of the virus. So, and then others that maybe they knew of people that got the virus and they weren't that sick. So they thought, well, I'll roll the dice, I'll take my chances with just getting the virus. So we're sort of all over the place. But I think the biggest piece of it is that we got an opportunity on the street to see what this virus can do to folks, and to see its effect, see the level of illness and the volume of people that, were affected by it, I think is in, the subliminal for firefighters that are on the street and doing it. And then we're like anybody else. I have a mother who's, diabetic. She's on dialysis. If she gets this, my thought was she'd be dead in 20 minutes, So I want to be extra cautious. I'm not really afraid of getting it, but I am afraid of giving it to her. She lost a brother this year to it. And, I saw the impact of just having to accept that he was gone and not be able to say goodbye. It was horrendous. So I think all of us have had our own experience with that, and so I think that has sort of built our picture. We're better than 50% of folks that are vaccinated. And then now the numbers are it's kind of hard to track because we were doing things in closed pods where we were able to track all of the people that received the vaccine. And now that it's so available, we realize that there are people that are getting the vaccine outside the fire department, outside the city. But we're imagining that number of vaccinated folks is higher than the 50%. That goal, being that herd immunity, try to get to 70%. But it has impacted everything we do in the fire service, the way we train, the way we eat dinner together, how we live in the firehouse. It has made a significant change for us. So I think all of us are, eager to see this go away.
Absolutely. Well, I wanted Morgan to share her experience because Morgan actually had COVID and it wasn't an easy journey. Morgan, tell us about that.
Yeah, so, I thought I was being safe, washing my hands, wearing my mask. And then I had a cough, started with a cough, and I'm like, oh, it's just a cough. I was feeling fine. And then it turned into a head cold. It felt like it was a head cold. and I teach a fitness class. And so I was still like working out, and I was like, y'all, I have a head cold, just excuse me. But then I was like, you know what, I'm just going to quarantine just in case, because I'm not trying to get anybody sick. And so I canceled, like I had a shoot coming up, I had a makeup appointment, like I canceled all that stuff. And I started losing my sense of smell, and I thought it was just because of, my sinuses. So, I called my dad, and I was like, Dad, I can't, smell. I'm like, I can still smell a little bit, but I think I have a head cold. And the thing is, we were all over their house for Thanksgiving, but we all wore a mask, and he made us eat in different rooms. And this was back in November. So he was serious. He's like, y'all can come get some food, but you have to segregate. So like my parents were in the kitchen. I was in a room by myself. One brother was in a room by himself. The other was in the basement. So we were really social distancing, eating Thanksgiving. And then maybe another day went by, and I lost my sense of smell and taste completely. So that was a Tuesday, and I was like, you know what? I'm going to go get a COVID test. So I went and got a test. And then Thursday, it felt like it was the worst day for me. And sure enough, my results came back positive. And I just boohooed like a crybaby, because I didn't know what was going to happen. Like I said, I'm single, I live alone. I have a little dog. So my parents can't come, because now the whole family is in quarantine because I tested positive. So, my parents are above 60 years old, and they're more susceptible to, they're in that group that can really, really get sick. And so my dad's assistant from all the way from Dayton came and brought me food and brought me an aspirator for my breathing, to make sure that my breathing didn't go below a certain number, my oxygen.
You were having some breathing problems too, weren't you?
Yeah, so, and I actually videotaped myself just to see like the difference. And it felt like something was sitting on my chest, and I was talking very slow. It felt like I was like grasping for air a lot. And my dad was like, okay, well, you have to do this. You have to get up and walk around. The virus wants you to just lay there and rest and take over. The nighttime was the worst. I went through cold sweats, hot sweats. I couldn't breathe. I had to sleep like sitting up. And unlike any other like cold, where you feel like you're going to go to bed and wake up feeling better, it felt like I kept going to bed and waking up feeling worse. And so I was like, for me, I love food. And so the hardest thing was like, will I ever smell and taste again? And I would tell my parents, I'm like, what's the use of eating? They're like, to live, Morgan, you have to eat food. And so, I ate a lot of, power foods, try to boost my immune system. And like I said, I work out, I take my vitamins, and I really feel like I could have had it worse if I wasn't living a healthy lifestyle. Because I can definitely see how it can affect people who aren't in the best shape, who have breathing issues, who aren't as strong, because this virus will really eat and take away from your body and your strength. And then not to mention the after effects. So the fatigue is really what got me. When you're sick and you're in bed, but you can still do work, you can still do something. I couldn't even post on social media. I couldn't even write. I would type something. I would just get so tired that all I could do was just sit there and rest. Like, I know it's mind blowing, but I couldn't even post. And so people started checking on me because I post every day. That's what I do for a living. And they knew something was wrong with me because they didn't hear from me. And so even maybe 2 months after I had COVID, I was still fatigued. I would have to cancel Curvy cardio class. I couldn't work out. My taste, my smell came back gradually. All the things that I liked, like my perfume smelled horrible to me now. Things tasted weird. And I'm like, oh God, will this ever end? And so luckily my other brother tested positive for COVID, but he only lost his smell and taste. And he works out a lot. And luckily my parents tested negative. My other brother tested negative. So when I had the opportunity to get my vaccine back in February through CPS, because I still work in the schools, I took that opportunity and that chance to get it, because that's something I truly never, ever want to experience again. And like I said, I quarantined for 16 days.
Wow.
So,
So now, okay, so let me just jump in because I saw, you know, while you were talking, Ebony J kind of went like this. So Ebony J, what kind of effect is this story having on you?
Well, I mean, that's scary. She was really messed up. And, you know, I know that COVID can have really bad effects. I know a lot of people who got it during this time. I'm blessed and didn't go through it, but the stories, and that's the most terrifying thing. And just the fact that she's still here and survived. I mean, that's truly a blessing because a lot of people didn't survive it. A lot of people are gone. And so I know that that's the reason that we want to take the vaccine, so we can guarantee that we're going to be safe, that we are going to be able to live through it if we get it.
Yeah.
And the other thing is there are hundreds of millions of Americans who have actually gone ahead and had their had COVID and had the symptoms, but then have not recovered from the symptoms. So haven't died, but still have the symptoms. And the fact that you were healthy and that you were able to get through the symptoms, I'm really glad that that happened. One of the 4 people who passed away in my family was a bodybuilder, reggae guy, 53 years old. Worked out just that same week, and within 7 days, he was gone. We could not believe it. Healthy as he could be. And so, you know, again, the issue about long COVID and having symptoms, my daughter Francesca had, she's a college kid from Miami. She's graduating in a month. She had come over, she had come over with a friend of hers a couple of weeks ago. And so, you know, we ordered out Cheesecake Factory and we got cheesecake, we got some drinks, we went ahead and had steak and potatoes. Her friend had COVID. She couldn't taste the steak at all. That's her favorite food. And as far as the beverage, it was strawberry. She could only tell that it was sweet. And she had COVID months ago. And so again, it's not a guarantee that you're ever going to recover fully from that. So if you do and get no symptoms, great. If you get COVID and you get a few symptoms and it lasts for a period of time, that's great. But you can get COVID and survive and have lasting symptoms that are long-term. Having said that, having COVID, just like the fire chief spoke about, is that we actually have patients who have gone ahead and said, well, I've gotten COVID, I'm fine. I've got immunity, I'm good. That is incorrect. If you get COVID, you have no idea whether you get a good immune response or you don't get a good response. So therefore, you're not guaranteed that you won't get COVID again. So this is why, even after you've had COVID, it's extremely important to go ahead and still get vaccinated to protect yourself. Having COVID does not protect you.
Okay, and Tropicana, I wanted to jump back to you because you have, you know, a lot of young listeners, you know, you and Miss Ebony J. So, and you've been on like this campaign to get people vaccinated. You have been, you know, I hear you talking to your people and fussing and saying you've got to get vaccinated. I've seen you on television, you know, talking about it on the radio. So what is the reaction you're getting from your listeners? What are they saying?
You know, I'm really thankful for this platform that we have to share this information and to get this information out, and that people are listening. We have seen a completely different response towards the vaccine, because remember in the beginning, they were saying, I'm not getting it, I don't want it. And now even Ebony, who was just on here 3 months ago, like, I don't know, y'all, is still saying, okay, I'm considering it. So I'm really happy to see the positive impact of this information, even though sometimes it seems tedious because we kind of are saying the same thing and repetition is winning. So it's great, Jan Michelle. But I do have a couple of questions I wanted to ask Dr. Edgy. Couple quick myths or questions, however you want to call them. I was speaking with a young lady last week who said that she was diagnosed with an acute diagnosis of COVID. So she felt like because I didn't even know that was a thing, an acute diagnosis of COVID. Like I only got a little bit of COVID, y'all. Now I only got.
Well, acute actually doesn't mean little. It just means sudden. Okay. So acute means it just happened. Chronic, it's the opposite of chronic, which means I've had this for at least 3 weeks.
Okay, well, she felt like because she was diagnosed with an acute version of COVID, that she didn't quarantine as long. Can you kind of speak to that?
Oh,
Error. So absolutely, there is no, again, the acute part of it just means it just was diagnosed. It just happened just now. Okay, so forget the word acute. Everyone who gets COVID, it's acute. It happens now. So that was just an extra thing that was probably put on a billing sheet or something like that. So essentially, shake off the acute. She had COVID, and to all COVID, you need to quarantine.
Okay.
That's
And
the
isn't that a problem? People start coming up with, their own method, and it's like, no,
Right.
you need to follow the rules, right? I mean, you're supposed to quarantine, what, 14 days?
Absolutely.
Right.
Angie, what if you have COVID when you go get the vaccine?
So the question is, if you do have COVID and it's proven you do have a COVID test, you have to wait for 60 days from your positive test before you're able to go ahead and get the COVID vaccine.
But if you
One other thing to note is, oh, I'm sorry, go ahead.
if you are not diagnosed with COVID, or you find out you had COVID after you get the vaccine, you weren't aware, and you go in, will we have any like reaction to the vaccine if you were to get it without knowing?
You will probably get the same sort of response that as if you had COVID before a while ago, which usually means, when they talk about the Moderna and the Pfizer vaccines, and that the second shot is more reactogenic, your body has a more robust and strong response to it. If you've had COVID, you may have that same expected response that you would have had for the second vaccine for the first one, because having had COVID gives you the same effect of sort of having the first vaccine, except not the protection, right? So that I would expect you probably have a little bit more of the 5 major symptoms that we see after the second vaccine. So fatigue, a little bit of headache, possible fever, joint aches, and muscle aches.
And those last a few days sometimes.
Yeah,
right?
and they only last usually for 24 hours, mainly because of the mechanism of action of mRNA. So mRNA is just a blueprint for how to make one portion, the little spike protein on the top of the virus. And so they just give you a little recipe book that's wrapped in a little bit of fat, injected into your body. And that is like a Snapchat message. It stays in your system for about 24 hours, enough time for your body to figure out, okay, now I know how to make an army against COVID. And so usually the symptoms only last for about 24 hours because the mRNA only lasts in your body for that period of time.
And one last question, Dr. Edgy, for those who, are kind of in fear or concerned about the inconvenience of maybe getting sick for 24 hours or for 48 hours, so they are avoiding getting the vaccine, what would you say to them in comparison to COVID versus getting vaccinated?
Oh, absolutely. So with the vaccine, there have been 0 hospitalizations with the 2 mRNA vaccines and 0 deaths. There were 30,000 of us. There's still 30,000 of us in the Moderna trial. There were 44,000 in Pfizer. 0 hospitalizations with severe COVID and 0 deaths. So number one, if you get the vaccine, you will not have hospitalization or death. That's the first thing. Secondly, if you get COVID, you could get long COVID where your symptoms last forever and you can't taste another steak for the rest of your life. You don't know that. It's like Russian roulette, okay? The other thing is, you could die from COVID. You could get a stroke from COVID. You can get all kinds of things that COVID affects just about every single organ in your body, including your brain. So there's something called COVID brain fog, where people are just not able to think acutely and think as clearly as they used to, remembering phone numbers, remembering people, remembering addresses, remembering things that were remote, long-term memory, things like that. Those are risks that you take when you don't get vaccinated.
And that will last forever, or is it just for a period of time?
It depends on the individual. It
And
can
so-
last forever, and that's the risk, right?
Yeah.
You don't know.
And Dr. Edgy, is it true? And Cleveland Stokes, I know, is waiting with the question. So Mr. Stokes, we're getting there. Hold on one second. But so is it true that we don't really even know all the long-term effects because we're still worried about, our lungs, or those of us who've had COVID up the road, are we still going to have some breathing problems and, as you said, memory problems?
Yeah. For the patients who have an underlying health condition, your lasting effects are potentially much longer than they otherwise would be. So if you've got an underlying health condition, asthma, for example, and you do get affected, with respiratory symptoms from COVID, that could affect you may not go back to your baseline. So, usually, let's say you have an asthma attack, you go to the hospital, you get treated, you're good. You go back to how your lungs were before. If you get COVID on top of respiratory related issues, you may not go back to your baseline once you've had standard treatment.
Okay, so you know what, now, there's another question that's popped up that we haven't addressed yet. I think we kind of talked about it, but, it's from Cleveland Stokes, and he said, well, we have to take the vaccine every year. And
So that's a great question. And I alluded to part of it earlier. Again, before we had the variants, it was looking like we would not probably need to have this vaccine more than once once every year to 2 years. And basically what happens with vaccines, if they check your blood after you've been vaccinated in a trial and your blood is still really strong against the virus at 4 months, usually you're able to go ahead and say that this vaccine is good for at least 1 to 2 years. The caveat, the thing that's different this time around is now we have the variants. And so B117, not so much of an issue because we still know Moderna covers that. But it's the other variants, the South African, the Brazilian variant. And again, any area, I'm expecting a Michigan variant to come out, quite frankly, because again, you've got variants that are coming out of places that are out of control. Michigan is one of the biggest ones for that right now. But our vaccines that were created for the original virus work, and we expect they'll continue to work for the 2 years. But if you get one of the variants and the variants start to take over, then we're gonna have to wait and see. And again, we expect a Moderna booster potentially, and this is per the CEO earlier today, toward the end of fall, before we get into the winter months, we'll probably need another Moderna or Pfizer booster to cover the variants.
Dr. Edgy, can you kind of speak to how, like Jim earlier, that Franklin County has gone back into the purple, and the news has been reporting that across the Midwest that we are on an influx of COVID outbreaks?
Absolutely. So the reason for that is the new variants. Every time that a virus makes more of itself, it has errors, and it makes those errors. And then before you know it, it's just like making an error in a key. Every time you make a new key, the little ridges, something else happens. And before you know it, you can't fit that key in the lock anymore and won't open the door. So this is the same thing that is happening with the variants. And so what we do know about the variants, B117 in particular, plus the other ones, is that number one, they are much more transmissible. So you can get infected so much faster being exposed. So for example, the whole, we were doing great socially distancing at Thanksgiving, the story that we just heard. Had there been B117 that had been part of that situation, instead of just having your brother getting COVID, it probably would have been the entire household, because B117 is so much more efficient at getting from one person to the next. So not only do we have variants spinning out, but the variants are smarter. And I hate to, personalize a virus, but they are more efficient at getting to people. They find people faster and more efficiently. So this is why the variants are a problem. And that's why we still need people masking and socially distancing because of exposure to variants.
And Dr. I'm going to let you jump right back in. Let me just say this: the B117 is the one that people refer to as the UK virus, but we're trying not to put countries on it because folks just go crazy. So we're trying to stick with numbers, but just so people know what it is we're talking about.
Thank you for bringing up that point.
Yeah. Okay, Tropicana, I'm sorry. Go right ahead.
I was just wondering, how safe is it for us to be dispelling the mask mandates, or to be opening up while we are pushing the vaccine out?
Very dangerous. And I will tell you this, and I don't mean to get political, but I will say this, that in Michigan, they did strip the governor of some of her duties as a governor because she shut Michigan down before. She is close to needing to shut Michigan down again, because right now it is just running rampant. And I tell you, the curve, we have these little humps in April. The Michigan curve is like a skyrocket straight up. And who knows where the curve is going to end. What happens in the process of that curve, people get hospitalized. The doctors get overwhelmed in the hospitals because they get filled with people, and people die. And imagine, go all the way back to April when we didn't know anything about the vaccines. We didn't have anything available. And it will be back to that space if we get variants that are completely new. Now we've got a completely new set of doors and the keys don't fit for everything, then that will be going back to scratch. So we've got this window in the next 3 to 5 weeks where we need to get as many people vaccinated as possible to keep those variants at bay.
And so what's happening
Well,
in Columbus, like right, like not that far from us, so an hour and a half away in our, state capital, and they've gone purple. What's happening there? Any idea?
I'm sorry, I didn't hear the first part of the question.
I said, what's happening in Columbus, which is Franklin County, which has gone, this past week it went purple, which is the highest level of, outbreak.
Yeah,
Dangerous. I wonder what happened there.
Yeah, I think it's getting back to people feeling comfortable that, we've got vaccines coming out, people starting to get really tired, COVID fatigue, basically just getting tired of having to be indoors. The weather is getting better. It's getting sunny out there. It's a totally different sort of mindset. I think people are getting tired, quite frankly.
And just kind of relaxing and saying, I'm gonna go to the bar and hang out with my friends, and
because I got my shot. I mean, it's not protection against variants, except for B117 that we're aware. So again, we've got to really make sure we continue to mask and social distance. And, this is preventing us from having the flu. Like, last year, we had hardly any flu vaccines that were needed because people were doing really, really well.
So let me jump back to Morgan. Morgan, so did you get your vaccine?
Yep, I got Pfizer back in end of February and then early March.
Okay, any reaction there?
No, so actually my parents got theirs first. My dad was the first one to get it back in January, and he's just had the second shot. He just felt tired. My mom, she just had like cold chills. So I was prepared. I took that Friday off and I was like, ooh, I'm gonna lay in bed, I'm gonna rest. I was ready. And then I just felt like a little tired. I'm like, come on, I took the whole day off. I was like ready to work in the bed, but I just felt tired. And then I was fine. So, but I know it affects everyone differently. So yeah, I was good.
what are the most common side effects to when you're getting your vaccine?
So the 5 that I mentioned are the 5 ones that people tend to have with the Moderna and also with J&J as well. So fatigue, so 2 Fs, fatigue and fever are 2. Then muscle and joint pain. And the other thing is for some patients, and this depends, a headache is one other one. So.
Yeah, my dad told me, if you have side effects, that means it's working. So.
Exactly.
Okay, that's good. And Mr. Smith, so I'm going back to the firefighters because I know they're together. They live together, during their shift, right? They're in the firehouse together, so there's no way they could really social distance. Are they? And I know you said some of them were vaccinated and some weren't, but how's that going? I mean, are you seeing a higher rate of firefighters with COVID, or what's going on there?
Well, the trends in the fire department, they follow the community trends, right? What we saw in the community with COVID, we saw it in the firehouse. And so pretty much once we started to vaccinate, we've seen the stabilization of COVID cases in the firehouse. So we have some internal policy that drives, wearing masks when you're within 6 feet inside the firehouse. We've encouraged them. A big piece of the fire service is that we eat together. We cook a meal together, we eat together, and we've asked them to alter that. As the executive staff, we had a habit of spending about a day a week just having lunch with folks on the company. But a lot of those policies, the visits to the firehouse, the touch truck stuff, our visitation with them, training, all of that was altered to discourage in these situations where COVID could transmit. But we still have a lot of things like when we fight fire, we have to be close to each other, And so, there's some policy just to drive and remind them of those sorts of things, information, washing your hands, you're safe, cough in the elbow, things like that. We're not out of the woods. So even though we're vaccinated, we know that there's still a possibility to transmit it. So those policies are still in place. In our fire department, every week we circulate what we call an incident action plan that has reminders about this behavior, the things that they should do and should not do, because they still apply. And then we still track those numbers, but they have stabilized quite a bit, where we don't see the transmissions nearly to the effect that we have. Some months we might have had as many as 20 or 40 cases, new cases of COVID, and we're far less than that. In fact, we don't have anybody currently that is on a leave for, COVID quarantine. Everybody's back to work at this point.
Oh, that's good news. I do worry about mental health because the firefighters, like doctors and nurses and healthcare workers, you all are out there on the front lines. You're seeing people who are really sick and, in some cases, people who are dying like on a regular basis. So how's that? What about that piece of it?
So you raise a really powerful point, and I can't help but to go back and say, dealing with this for now since, January of last year, healthcare providers, people on the front lines, they are tired, beyond tired, because they're still having to provide that same level of care, and not just physically from working long hours or things like that, but they are mentally and emotionally exhausted. And, the effects, we won't probably see that fully for maybe into the future, what it is doing to our psyche, our emotion to, not have some kind of normal life and have everything completely changed. So it's a concern for us, because we have the stress that's associated with providing an emergency service. We see things sometimes that most people don't see. And now you add this extra thing, you're at home, more time to argue at home. We see effects on marriages and relationships and things like that. So it is cumulative. And I think, as community leaders, we have to be kind of looking at that, not just the people that we serve, but those of us that are providing that service. They were kind of watching each other and making sure our mental health is intact, because now we have this added stress compounded and exacerbated by each of the circumstances that are associated with it. So I think, that's going to be our new thing, not just in the fire service, but throughout our entire community of what the impact is. So needless to say, if we go back, we say, well, hey, the sooner we can get past this, the better. But we look at it like water pressure, right? If you lose water pressure in the fire service, it takes you a little bit to build that back. So you never want to lose that. So the progress that we're getting, it's important that we don't get sidetracked completely by another variant that makes us have to essentially start everything over. All of these programs that we have developed, to have to completely start that over could have an absolutely catastrophic effect on our community.
Absolutely. Well, Ebony Jane, let's go back to you. So I'm not convinced that you're convinced that you're going to get vaccinated, right? Are you still kind of on the fence? And if you are, tell me, what information do you need to feel comfortable getting vaccinated?
I would like more information about the different variants. I have to admit, I'm really terrified of needles, and I don't really have a great experience with them. So hearing that I may possibly, may not be me getting 2 shots, but I may have to come back and get another shot because of the different variants and the control. That part has me a little nervous.
Okay, so that's a great question. So one thing you don't want to do is to be part of what makes the variants worse, right? Because what happens is, if we're not keeping things under control, the people who are not getting vaccinated, that's where the variants can start to flourish. So as far as the shots go, again, this is a nanosecond pinch into your arm twice, 2 weeks or 3 weeks or 4 weeks apart, and potentially a booster down the line. And that could protect you, from dying and from getting to the hospital. So that's one thing important. Now, you spoke about the variants. The B117, the UK variant, is the predominant variant here in the United States. But you have the other ones that are coming to the fore as well. Again, the Brazilian, the South African ones that, are evading some of the vaccines. In fact, of course, in South Africa, they had a bunch of Pfizer. They bought all these Pfizer vaccines, and they returned them. They're like, you know what, we've got this down here. It's not going to work against it. So, again, we don't want that to become the predominant one here, because then we're left as if we don't have any vaccines at all, right? So we need to just make sure they don't get out of control. And the only way to do that is to get people, 70% of our community vaccinated. And when I say our community, the United States. Right now, we're just over 1/3 of the country vaccinated with at least one vaccine, which is excellent. But we still have to get to that 70% for things to just kind of calm down. The other thing is, of course, the folks who are in the 65 and older, we've got 75%. We've got herd immunity in that crew, but they don't get herd immunity unless all of us get herd immunity, because as the fire chief said, you worry about bringing the virus home to folks who are in that age group as well. So
Okay.
So
And-
are you saying that if we do not get the vaccine, people that are around each other who don't get the vaccine, they are the people that are making the new variants?
The variant can actually jump into your space very easily. And again, it's the folks who are not wearing masks and not doing other things that also contribute to that space. So there really are two categories, vaccinated or not vaccinated. And the virus doesn't differentiate. It goes to the folks that are vaccinated and they're like, can't get in. And then they keep on moving. Not vaccinated, let me do my thing. And so you want to have as few places for that virus to jump before it's gone, right? And you want every single spot that it jumps to already be vaccinated so it can't do anything. The fewer people that are vaccinated, the more times that the virus can infect somebody. And every time it infects, it has an opportunity to spin out another variant. So that's the problem with being unvaccinated.
So once you get the first vaccine, you have to wait a couple weeks and come back and get the other vaccine. And if something, and because of the different variants, you may possibly have to come back in the year's time or the fall to get another portion to protect you from the other variants.
So to be clear, the space between Moderna and Pfizer is 3 weeks for Pfizer and 4 weeks for Moderna. When I said yes to the 2 weeks, I thought you were going to say that 2 weeks after you get vaccinated, that's when you're starting to see protection, right? It's 2 weeks after the second dose of the 2 doses, or if J&J's back, which I expect it will be within the next week and a half, it'll be 2 weeks after J&J that you'll be fully protected. And so at that point, good news, if you've been vaccinated and someone else has been vaccinated, you can meet together without masking and socially distancing in small groups. That's the benefit.
I wanted to mention Ebony J, because, you said you're afraid of needles. Here's my 16-year-old son who got his second vaccine today. He's afraid of needles too. Tell us if it hurt, Asher. Asher, get in the camera.
Yeah, I'm in the camera.
No, you're not. We can't see. Okay, tell Miss Ebony J how it felt.
I didn't even feel it.
You didn't feel it at all?
No.
And Ebony, a small prick is worth more than having COVID. Like you don't want that. A little boop and you're done is better than COVID. So don't let that hold you up. Get a little needle.
Okay.
Okay, so you heard it. My son does not like needles, Miss Ebony J. He's a lot like you, and he was like, "Oh, it's over." I mean, he really didn't feel it. So don't be afraid. I've had it too. It didn't bother me at all. This has been really great information. I'm going to turn it over to Tropicana to take us out here, and then she's going to turn it over to Miss Renee Mahaffey Harris. So Tropicana, go right ahead.
Thank everybody on our panel, Mr. Smith, Dr. Edgy. You are just a fabulous source of information, and you are so. My homegirl Ebony J, girl, go get your vaccine. Go get it. I'm gonna take you to get it. Morgan, thank you as well, and of course the fabulous and the amazing Miss Janice McKerney. You are the best moderator ever, and I have to put the sauce on the best. Miss Renee Mahaffey Harris, who tells me not to give her a big introduction, but we would have this panel if it was not for your dedication and commitment to making sure that we all live a healthier life. So thank you for your service and everything that you do. Turning it over to you.
Well, thank you. Thank you all. This was a great conversation. I hope Ebony J, this is not focused on you, Ebony J, but I think you have a voice and I think you've asked questions, and I hope that many of the concerns and questions that you had you've gotten some answers now that you can share. What's most important for all of us is what Dr. Edgy said, is the more we get vaccinated, the less likely it is for the variant to spread in our community. The question about Columbus has more to do with the proximity to Cleveland, Cleveland's proximity to Michigan. So that's why, we're seeing these increases, right? And so we know that getting vaccinated, I am fully vaccinated now as of today. Yay. And, I think that, as Fire Chief Smith spoke about the fact that the mental drain, and Jan Michelle, your comment, it is affecting all of us, right? Yes, we are fatigued, we're stressed, we there are a lot of things happening. So the more that we get vaccinated, the more likely it is we'll get to whatever that new normal is going to be for us. This is an instance where vaccine helps us save others. Wearing a mask, social distancing, and washing your hands saves others. This is about us saving each other. So we must save us. So I also invite all of you who are listening, and we'll rebroadcast this coming week. On Saturday, Saturday, April 24th, we'll have our virtual health expo. It'll air from 10 to 4 on wemustsaveus.com. So go there to register. And also it will air at noon on Local 12 for 90 minutes. And so you'll have all kinds of ways to get information, fitness demonstrations, entertainment. Wow, we're going to have an incredible lineup, and you'll hear more on Radio 1, on all 3 stations, on Local 12, on our other stations, at the Cincinnati Herald. So get the word out, get people registered, but they can also watch on Local 12 on April 24th at noon. And also, we are going to be vaccinating people at Music Hall Ballroom because of our health systems. UC Health, Christ Hospital, Mercy, Tri-Health, make sure I don't forget anybody, Cincinnati Children's, and Cincinnati Health Department are making a vaccination event possible at Music Hall Ballroom from 10 to 4. On Monday, we will release the QR code. So please register. We have limited vaccine. We want you to get vaccinated. Join us for We Must Save Us. Get information, informed decision, save each other. Thank you all so much, and you'll have a blessed weekend.
Thanks, Renee.
Bye.
Bye.